Good morning to all our Facebook viewers on Facebook Live. Welcome to another episode of Stay Healthy, Doctor Talk. The topic for today's discussion is fixing your broken heart valve. As we are quite well aware, our heart is a part of our body that we cannot do without. Basically, without our heart, we cannot live. Therefore, our heart is very important to us, and if there is a problem with it, we could be in trouble. But fret not, we have a heart specialist here with us, our cardiologist here at Bumrungrad International, Dr. Wattanaphol Pipathananun. Dr. Wattanaphol specializes in interventional cardiology with special interests in radial approach angioplasty, crush stenting technique, and transcatheter aortic valve implantation, or TAVI. He is the director of Bumrungrad Heart Valve Center in Bumrungrad International. Welcome, Dr. Wattanaphol.
Good morning. My pleasure to be here this morning.
Yes, so we all know that our heart is important, and if there's something wrong with it, we could be in trouble. Our topic, we have lots and lots of things that can go wrong with our heart, but we're going to be concentrating on our heart valve and some heart valve disorders. So I'd like to ask you, what is a heart valve?
Okay.
What
so
and
today
where?
We're going to talk about broken heart.
Yes, broken heart.
Valve.
Yes.
Not broken heart only.
No.
Okay, so that everyone knows that your heart working 24/7. Every single minute, every second is pumping all the blood to supply all over your body. So your heart that sitting behind the chest bone, as we saw in the picture here, and the pumping the blood to give the well oxygenated blood to supply over all your body. And the heart itself have the artery to supply, to give the oxygenation and the energy to the heart muscle itself. They have the artery to supply the heart. They have the vein that get the poor oxygenated blood from the heart back to the lungs to get the perfusion. And back to the question that Dr. Eliseo asked about the heart valve. So imagine that your heart is like a pumping. So you have the two chambers, left top chambers, that's gonna get the poor oxygenated blood from your body back to the left top chamber, and then get through the valve down to the left bottom chamber. To right top chamber first, and down to the right bottom chamber, and then go to the lungs to make the oxygenation, and back to the left top chamber, and down to the left bottom, and then supply over your body. That you may see the valve. Here the full valve. Yeah. Can you open this one? So the main one that we found the problem quite a lot is called aortic valve. That's the main valve between the left bottom chamber and the main aorta, the main artery. When people get older, that one can be the degeneration. Another one that also the most common problem is the mitral valve, that between the left top chamber and the left bottom chamber, that also get degeneration when over time.
So what is the main function of these valves?
Yeah, it's like a gate, a door.
Yes.
Between your chamber, your heart chamber. So when the top chamber squeeze the blood through the bottom chamber, get through the valve opening, and after the bottom chamber squeeze the blood through the main blood pipe, the valve between top and bottom chamber is gonna be closed like this. Yeah.
Okay, so they act as gates, and how do they get a disorder? What causes the disorders of these valves?
If we're talking about the valve problems back to 20, 30 years ago, mainly that we talking about rheumatic infection, the bacterial infection or the damage since they were the younghood. And particularly in our Southeast Asia people, lot of rheumatic heart disease quite common in the heart valve disorder. But now the people live longer, the better healthcare, the incidence of rheumatic heart disease is quite less.
Right. So right now, what is the most common, in the past it must have been rheumatic heart disorder, but now in the modern times, what is the most common heart valve disorder that we
Now
have?
we are moving to the aging society, so the cases of the degeneration or the damage valve when people get older, that get more common.
Yes, okay. All right. And, you know, with heart attack or myocardial infarction, you would be having chest pains, difficulty in breathing. But with heart valve disorders, what signs and symptoms do you have? What will make you suspicious that you might have heart valve disorder?
Yeah, that you may take a look in the slide. The symptom of the heart valve disorder or is quite same like other kind of the heart disease symptom. People may complain like a tired, shortness of breath, or some rhythm problem, palpitation, skipping beat, and if it turns to be bad shape of the heart pumping, it's called the heart failure. They suffer from the fluid accumulate in the heart, in the lungs, or down to the stomach, the legs. So people may come with the legs swelling, discomfort, chest, stomach.
Okay. And if it starts getting worse and worse, when should they come and see you, and what can be done?
Yeah, for sure. When we get the patient with complaint like a shortness of breath, legs swollen, or congestion of the lungs, we need the test. We need the blood test, the film, the echo, and most of the cases we start with the medications. For example, the water pill remove the fluid, some heart medication that to reduce the workload to the heart. For example, the high blood pressure pill, water pill, and some beta blocker that to slow down the heartbeat. Everything maintained to reduce the workload to the heart.
So that's some sort of conservative treatment where you treat
First.
with medication first.
Yeah.
And what else can you do if it still does not get better?
So in the more severity of the heart valve disorder, for sure the medication alone, that may not enough. So we have to go for the repair or the replacement for the new valve.
Yeah, so can you explain to us?
So maybe we go for the next slide that about the most common
Yes.
that we're talking about the mitral regurgitation. That valve is sitting between the left top chamber and left bottom chamber. The mitral valve will block the left top chamber when the left bottom chamber squeeze the blood supply to aorta. And the degenerations mostly is go for the leaky or leakage. Mitral valve leaky, that means they're not close enough. So the medication to reduce the workload to the left bottom chamber, give some water pill, remove the fluid, and fixing that may require the repair. Put some like the mitral valve ring or the replacement in very severe case. That we call the mitral valve replacement. The next one that nowadays is more common, we call aortic stenosis. That mainly found in very elderly people with the degeneration and calcified deposit at the valve leaflet. So the valve cannot open properly. When the left bottom chamber pump, they cannot get adequate blood through the aortic valve. So the treatment is medications and then maybe the replacement.
Okay.
In the past, you may have heard about the aortic valve replacement. That the standard technique. The surgeon has to cut through your chest bone, put the patient on the heart lung machine, stop the heart, cut the old valve out, sewing the new valve in, and the total timing for surgery that may be taking for 4 or 5 hours. And with the people that really elderly, that's common for this condition is the patient may not tolerate the major surgery like that.
So that's a very, very major surgery that we used to do in the past.
Correct.
And so now with the new modern technology, what do we have that doesn't require such a big surgery and is able to be done safely on older patients?
Yeah. So we call the transcatheter treatment that put the new valve in through the groin artery, and the catheter with the new valve gets upward to your heart valve, balloon opening the old one, and then put the new one in. The new valve is gonna work right away after we put the new valve in. Yeah, that's maybe this one. That's the normal valve. And when we're talking about aortic stenosis, the left bottom part cannot pump the blood through the aorta properly because the stiff valves. So in the past, we had to get the old one out, sewing the new one. Now with the new technique, can put the catheter in. So put the catheter down, the old valve, and then the balloon open the old one. With the more space inside the damaged valve, and then we remove the balloon out. And then go with the new valve. Open with the balloon again. So now the valve cannot work right away after everything out. Yeah, that's we call the transcatheter, the aortic valve replacement,
Right.
or implantation.
Right, so this doesn't require any open heart surgery, it doesn't require cutting the chest open.
No, we just put the small incision that your groin artery, and the new valve get in through there with the inside the catheter.
Yes, wow.
And that's gonna be take 1 or 1.5 hours for the total procedure.
Wow, before it used to be 5 hours or more.
Correct.
Cut open the chest and long time to recover, and most of the time the outcome is not very good.
Correct.
But then this time we have this new technology where we just have to insert a catheter in the groin area, 1 hour, 1 and a half, and it's finished.
And in some cases, we can just put on the light sedation. No need for the general anesthetic.
Okay, that's very interesting.
And most of the cases can get up, have walking right away in that day or the next following day.
Oh, okay. So in many cases, age at this time might not be a very serious contraindication to this type of surgery. It's something that is safe for older people to undertake also.
And actually, it's now the new guideline. They recommend the high-risk patients. For example, very advanced age and with many comorbidity problems. The recommendation is going to be go for the transcatheter implantation. That's preferable than the old open technique.
Okay. So are there any other minimally invasive surgical options?
The most common one that we're talking about is the aortic stenosis. Another one is the mitral leakage that we're talking about.
Yes.
the mitral leakage, that means the mitral valve between left top chamber and left bottom chamber cannot close properly. So when once the left bottom chamber squeeze the blood, some blood that moving upward leak back to the left bottom chamber. So with the leaky valve, that means the blood gonna be go back and forth. That make more workload to the left bottom chamber, and also sometimes may have the pressure back to the lungs, make some more congestion fluid in the lungs. So the old technique that it had to be go for the open chest surgery and put the suture, put the ring in, or even fix with the new valve. The new technique, same thing, that minimal invasive, put the catheter but in the vein at your groin. Oops, sorry. And then the cardiologist will puncture from the septum, the interatrial wall from the right top chamber, get through the left top chamber. And with the like a clip, we call the mitral clip procedure, to sew or just clip the big leaky valve, turn to be just small area of the leaky valve. So rotate with the like a steering machine, put the mitral, the new clip down there to fix and stick between the two leaflets of the mitral valve, like this. So we talking about the area from big leaky area to be small area of the leaky, and then everything out. Is before it's big area of the leaky, and then after we put the clip, you see the leaky quite less.
Yes.
And that help for the people with severe the mitral regurgitation.
Okay.
Also, there's no need for open chest, no need for the big general anesthetic procedure.
So you have two common valve disorders. That would be mitral regurgitation and what we discussed earlier is aortic stenosis.
Correct, yeah.
And we have two procedures that we're able to do minimally invasive surgery, and operative time is very low. What are the benefits other benefits that the patient can get with this type of surgery, and what also are the risks involved?
The risk is quite same like a standard technique, the replacement technique. After the put device in, patient still need to take the blood thinner.
Okay.
But that for about 3 months or 6 months. In some particular patient that cannot tolerate the blood thinner, that may be contraindication for this kind of procedure. But overall, this minimal invasive, that's quite safe. And again, when we go for the shorter duration for the procedure, less complication, like a less bleeding, less of the infection, like for example pneumonia or the urinary tract infection, quite less incident than the standard technique. Again, quick recover. The patient can go back home, back to work as usual in the short period of time.
Okay, that's very good. Very, very interesting.
And in next coming, maybe end of this year or next coming year, the mitral leakage can fix by the whole system like a TAVI. That means not just clip.
Yes.
We can go to do the transcatheter mitral valve replacement.
Okay.
Same concept like a TAVI.
Yes.
Put the new valve, everything through the catheter. It's coming soon.
That's very
So
good.
we can go to episode 2 soon.
Yes.
Yeah.
Okay. Is there any other thing that you'd like to share with us that our audience would be interested in knowing?
So I would say for the symptom, mostly you cannot tell the symptom from the valve disorder or from the overall the heart disease disorder. Every kind of the heart disease the symptom mostly it show up like a shortness of breath, tired easily, chest discomfort, dizziness, legs swollen. So we prefer to go for the like an annual check or the with question with any symptom concern you come to the doctor, either the checkup department or the cardiologist clinic. We check for the blood test, check the physical examination. Most of the valve disorder we can hear by the heart murmur and do the echo for quick screening about the heart valve disorder.
Okay.
Yeah.
Thank you very much, Dr. Wattanaphol. We have some questions here from the Facebook Live. One question from Mr. Moshir Rahman is, what is the survival rate for heart valve replacement surgery?
I would say if the question about the patency of the new valve, now the longevity of the new valve, that about 10 or 15 years.
Okay.
That means the TAVI we prefer doing in quite a bit advanced age. In younger age, still have no data, no information a lot, because the valve is good for 10 or 15 years.
Right.
If we fix the TAVI in younger patient, they may require the second time or third time, which is right now no information, no data.
I see. So the next question is also, it's related, is how many times is it possible for the heart valve to be replaced?
Yeah.
How many times can it be done?
For the TAVI now we can do, it's called valve in valve. For the second one, that's many institutions can go for the second time.
Okay.
But the third time, no recommendation yet.
Yes.
So let's say
twice.
if we see got the patient that suffer from aortic stenosis in younger age, the first time probably have to go the standard technique first,
I see.
the open surgery for the first time. And time goes by, the second time after 20 years, 15 years, that may go the first TAVI. And then for the second time is the third time is second TAVI.
Okay, so open heart surgery for young patients first, then there will be the option for TAVI and then another TAVI. I see.
That based on information.
The
right
current
now.
research and information that we have.
Maybe in the future we can go everywhere, every age for the TAVI.
Okay. There's one question here, a general question about how do we control high blood pressure? Do we control our food, or what other things are we supposed to do?
High blood pressure is the most common the illness, and again it's the over 40 years old, 50 years old incident about 5%, 10% in general population. Mostly reduce weight that can help. Reduce salt. Salty food can make your blood pressure goes up high. Exercise can help. But again, we may have to go for the medication if non-medication cannot good control.
Right. So lifestyle changes of getting enough rest, losing weight, reducing salt.
Correct.
These things
low salt,
actually help.
low fat,
Yes.
exercise, diet control that help.
Okay.
But not the whole thing.
Okay, thank you. One more question. How long does it take to recover from a TAVI operation?
Mostly just back to the recovery unit, the patient awake right away, and we're gonna have the team, the cardiac rehabilitation team. They will come to help and gonna go for the light exercise. Recover mostly that 1 or 2 days. Patient can walk around in the unit, can have some light exercise. Back to work maybe a week or 10 days after.
Okay.
Yeah.
That's very, very good results.
Right.
Yeah, so compared to compared to open heart surgery and valve replacement, TAVI, especially for older people, in that age group that's recommended for TAVI. This is a very big advantage in terms of recovery time, getting back to work or getting back to the regular daily activities. So this is something that is very good that Bumrungrad offers. Dr. Wattanaphol is the head of the department. And so if you know of anybody, or even if you yourself are experiencing the symptoms of having swollen feet, difficulty in breathing, tiredness or easy fatigability, it might be time for you to come and have an examination and see what the real problem is. Yes.
Correct.
Any other questions that we have? So the question is TAVI a major surgery? Yes. Is TAVI a major surgery? Is it considered a major surgery?
I would say semi-major or like a less invasive. So still we do in the cath lab or the hybrid OR. That means all sterile techniques still need for the operating theater. But again, with a minimal incision and with quite less sedation technique, patient can get recover quick. And again, the back to work, back to usual life, that shorter than the major surgery.
Okay. So of course you have to undergo general anesthesia, or is it just sedation?
Yeah, some cases.
Some cases just
50,
sedation.
50%.
I see. And then and so the recovery would be more from the anesthesia and
Just like other procedure.
right.
I would say most of the cases recover same like you undergo the balloon angioplasty. Yeah. So walk to the washroom and that night, have some light activity next following day.
And so the only pain that you'd be experiencing is the pain in the groin?
The pain just the groin.
Okay.
Or in some few cases that it's called anatomy that not big enough to get through the device through the groin. Few cases we may need to get through the apex.
Okay.
That's called apical approach.
Right.
That maybe take a bit longer for the recovery. But again, that any kind of the approach, apical or the groin technique is less invasive.
Right.
And shorter recover than the open heart surgery.
So how big is the wound in the groin when you have to put the
Just
catheter?
like 9 millimeter, 1
9
centimeter. That's it.
Okay, that's very, very good. Okay, and there's one question here also. It's actually in the same question, is about how much does TAVI cost?
Yeah, that the TAVI now I would say is about the third or fourth generation. So it's price still a bit pricey. Approximately in our center about 2 million baht.
Okay.
For the cost of TAVI, include the nice room stay, include
Yes.
everything.
Yes.
Approximately 2 million.
So about 9 millimeter incision,
quick
recovery, very fast return back to normal activities. I think this is a very, very
about
good treatment.
2 or 3 nights.
Yes.
Stay in hospital.
A good treatment to consider.
Yeah.
All right, any other questions? So I think we've already come to, yes? Oh, another one. So the question, in this COVID situation time, it's not possible to go to Thailand soon. Is there any other way I can consult the doctor online, please? Yes?
Yeah, we have the team, the telemedicine, that can arrange with the official heart center line. If you are interested in our staff, you get contact back to them.
Yes, yes.
Nowadays we have like a few cases every day for telemedicine.
Right.
Either from Myanmar, Middle East, Bangladesh.
Yes.
Yeah.
So Bumrungrad,
It's called new normal.
yes,
now.
Bumrungrad International has referral offices. Go to your nearest referral office in your country, and they'll be able to assist and set up a telemedicine consultation for you, where our doctors, our specialists here would be able to provide you some advice. And if treatment is necessary, then we could also start planning on bringing you here once the situation of COVID changes for your country and also for Thailand. So,
And we just got vaccine yesterday.
Yes, yes. So Thailand
So
has gotten.
hopefully-
Yes, I think once we start having the vaccine, things should be getting back to normal quite quickly, and that's something that we look forward to. And I'm sure all of you viewers out there that are wanting to come to Thailand, we hope that the situation will change soon. In the meantime, we have telemedicine, teleconsultation that you could avail of, our services where we could also provide advice.
And again, some of our patients last month, for example, they're very sick from Cambodia. So, for example, they call us the medical transportation.
Yes, yes.
You may get more details.
Right. You know, if it's a life and death situation and you're able to also get the certificate of entry into Thailand through the local consul in your area, and Bumrungrad International has our medical transport team where we would be able to help arrange and provide the documentation that's necessary and give you guidelines on how you would be able to transfer from your country to our hospital. So don't hesitate in contacting our referral office or Bumrungrad contact center, and we would be able to provide you more information. The medical transport team is capable of providing transportation of patients from your hospital, where you are, even as in an ICU situation. If the patient is fit to fly, we'll be able to transfer all the way here to our hospital as bed to bed. Or it could be at a lower level with doctor and nurse escort to bring you here safely. So we will not transfer a patient if the situation is not recommended, if the medical condition does not allow. But if it is possible and it is safe enough for a patient to transfer, we are capable of providing that service. So thank you very much, Dr. Wattanaphol.
You're welcome.
It has been a very interesting discussion, and this new technology that you and the hospital are able to provide and offer to our patients has been very informative. And I'm sure a lot of our patients will be benefiting from this type of information where they can start planning and making plans to avail of the treatment that's here. Thank you very much.
My pleasure.
Yeah.
Sawadee krap.